unfortunately, women are always blamed. Okay, but in reality, women only actually contribute 1/3 of the problem. Another 1/3 is by the male partner, and if you look at it, the final 1/3 is by both couples. That means both couples actually contribute in that way. So, in other words, if you look at statistics, women only contribute 50% of problems. So the male partner must be there all the time for consultation and investigations. Now, there's some truth to that because now the technology is so advanced. So if couple do seek further diagnosis and treatment, statistics do show that more than 50% do conceive. Okay, but we also must accept the fact that infertility could be a medical problem, and for some it might not be treatable. Okay, so therefore we cannot accept it as an 100%. Okay, so probably 50% and above will conceive. This may be actually traumatizing to some couples. Okay, because they are even more pressured than they are. But if you look at reality, okay, only a handful actually do conceive after they have adopted a child. Statistics actually show only 5% of those who adopt actually have a child. Okay, the thought behind that, I think, has been that once you have a child in the house, you get the right, you will get the right things in place. Okay, maybe even emotionally, maybe the environment, and therefore the mind may change. Okay, and therefore you may be put in a positive note to have a child. Okay, but as I said, okay, only 5% actually conceive. There is some truth to it, because we do realize that stress plays an important role, and for everyone stress levels are high, but they have different mechanism of coping. But if you do take a vacation, yes, you are probably away from the stress, okay, and if it is stress related, you may be able to overcome, but you must understand if there are medical problems, then that needs to be tackled. That is not true. Okay, because you must understand having regular cycles doesn't mean that they are ovulating. So that is all the more important. They need to see the gynecologist and have a scan done to check whether the follicles are growing, or do a blood test, to confirm that she had ovulated. Okay, only then do we say that she's fertile. I'm sure everyone reads. Okay, now that we have the internet, we are able to read a lot of things. It's good to know, but at the same time, it's good to get proper and right advice. Okay, I think once the couple are already facing problems, that means they've been trying for 6 months, for a year, and nothing seems to be working out, they best seek professional advice. It's always good to see a gynecologist and get the right test done and know what is the cause, and from there plan what is the next step to be done.